Dr. Gibbon, again in the US, was instrumental in bringing the development of the heart lung machine. Of course, he started after his first surgery. You have the patient there. That was a patient. That was a patient. After the first heart surgery, all the subsequent surgeries failed. The patients died. After 5 or 6, he stopped operating. And then somebody else took over the development of this machine. And today, there is no operating room in the world where there is no heart lung machine and a heart operation is being done. Everywhere, a heart lung machine, whether it is used or not, stands in the corner while a heart operation goes on. It may be a beating heart operation, but a heart lung machine is required. But if nobody had taken up this development, today heart operations, probably many of those heart operations would not have happened, and you wouldn't have heart operations like it is being done today happening. Let's go to the next one. Look at this. I just want to show you briefly how this. Look at this. How the heart lung machine was then. It used to be a huge console occupying half the room. Today, our heart lung machines are small consoles which sit in the corner of the room. For many of you, heart operation means cutting open the sternum or wrist bone and doing an operation. But since the mid-90s, probably since 1996 onwards, there has been a struggle to somehow avoid doing the heart operation by cutting open the sternum or breast bone. This is called the breast bone or sternum. For any major heart operation, this has to be cut through. But since 1996, constantly surgeons have been trying to overcome this. Why? When you cut open this bone, it is like breaking the handle of a bucket. This has the same impact on the chest. When you disrupt the chest, not only do you break the bone and cause pain, you also cause a lot more bleeding, and you also cause so much of destruction inside that the recovery process becomes prolonged. That is why you hear somebody underwent a heart operation, they require 3 months to recover. Somebody underwent a heart operation, after 1 year you ask them, I'm still struggling to recover. By simply eliminating a sternotomy, much of the trauma of a heart operation would be avoided. Blood loss, infection, return to activity, many things will happen faster. While we do a heart operation, in many cases we also use a heart lung machine and it is connected like this. I don't want to go into that, I'll keep this very simple. Probably one of the most common heart operations done today is a bypass heart operation. I think everybody here has heard what a CABG is. It's a common terminology in the media. And I think there's a huge population that is going to benefit from a bypass operation. And all traditional bypass operations were being done through a sternotomy. And this man, of course, here was instrumental in developing a bypass operation in the 1960s. Let's go to what happens when you do keyhole surgery. I'm going to take you through a couple of videos. And most of these videos are going to show you how you can do the same heart operation without cutting open the breast bone or sternum. I'm going to play this video. This is our team in Apollo, and we've been doing this for 11 years now at Apollo. And for us to go on into robotic heart surgery, this has been extremely crucial. And you can see that the surgeon is sitting here, that's me sitting there. Sorry. See, that's me sitting there. Oh, what is this? The pointer doesn't seem to be working with this. Every time I press the pointer, it stops. Okay, won't show anything there. So you can see that the surgeon sits there and uses fine stick-like instruments, which are used while watching the monitor, which is a high-resolution monitor. And this is a small hole. This is a valve replacement being done through a tiny hole in the chest. And everybody in the operating room can look at the monitor and see how the heart operation is being done. That is a hole, that's an artificial valve. You can see that this artificial valve is being introduced through that hole, which is as big as the valve. So you saw that. The size of the valve is approximately 21 to 23 millimeters, this kind of a valve. The hole is basically 2.5 centimeters, and through that you're introducing the valve. And you can imagine, compare that to a sternum being open, which is a huge cut, causing a lot of trauma. And here, no bones are cut. You simply make a small cut in between the ribs and then introduce. Let's go to the next one. One right here, you're going to see the same thing there. And particularly if a patient is very fat or very old, extremely beneficial. You can see how these wounds heal. They're already at 2.5 centimeters to 5 centimeters incisions. You can do a multi-vessel bypass also like this, where everything is done through small holes. You can see grafts there. There's a bypass grafts there. Again, very, very technical. I don't want to take you through technical things, but let me show you the next one. These are multi-vessel bypasses. Whether it is a young patient or an old patient, you see, multi-vessel bypasses can be done through 2.5, 3 centimeter cuts just below the left nipple. Similarly, like replacing a valve. And this has been our expertise because for the last 7 to 8 years, we've been doing this continuously on a practically daily basis. And currently, we have done the highest in the world. It's not India, highest in the world. So when you do these small surgeries without disrupting bone, patient recovery and activity levels are so high after surgery. You can see this man. This man is just 1 day post surgery. He has come from some Gulf country. Next day after heart surgery, he's able to walk comfortably like this. And these are the benefits, When somebody was asking me here among you, how soon can these patients return to work? If next day they're as fit as this, by day 3, they're so fit they can do all their normal activities. And many of these patients actually come back on the 4th or 5th day, driving their own car. This is something like laparoscopic surgery, very close to laparoscopic surgery, but obviously technically much, much more complex. We are still not doing this. I'm okay, don't worry. Still not doing this. This is robotic heart surgery. It's a multi-vessel robotic bypass. I brought this video only to show you. In India, nobody is doing this, not even us at this point in time. And this is the goal. Because when you do this, many thousands of patients, if many centers can do it, of course, many thousands of patients will benefit, help them recover extremely fast, return to normal life. This is exactly what you're going to see today, and some of you will have the chance to even play with these kind of tools, see how it works. Those are 1.5 to 2 millimeter vessels being stitched, basically a bypass to each other. You're using one artery to bypass a blocked artery. And these holes there, these ports are just 8 millimeters in size. So from incisions of 2.5 to 3 centimeters, we are now moving towards 8 millimeters. The ports are 8 millimeters. Like I said, you won't have a chance to see it. Again, technically very complex. I'll just leave it there. I'll show you. You can see it live. Thank you. Yes, these are basically non-absorbable stitches, and these stitches can heal inside. We'll wait for the questions. I think we'll do a question and answer session after the end of this program. Like Mr. Davison, our CEO, mentioned, I'm extremely glad to have Sir fly down from his busy work and join us here. So, sir, why don't you please, I invite you to come and inaugurate this session. I think you should come, sir. Most important. Yeah. Seriously, please. Everybody can come. Our whole team should come. Yeah. Sir, it's yours.
Good morning, everybody, and thank you for being here. Something which is very important, not just for all our but I think it's important for the country. Our joint managing director, Ms. Sangeeta Reddy, was supposed to be here, but he is in Delhi in the process of taking over as the president of FICCI, so she could not be here and sends the best wishes to Satki and the entire team, along with our chairman. I was very excited about this program. Apart from whatever is happening today, I think today is the day when journalists will become robotic surgeons. Well, I don't think anywhere in the world journalists had an opportunity to actually work on the robot and have a feel of the robot. So I think this is the first time that it's going to happen, and I really hope that you experience it and you really understand what a surgeon has to do to gain the skills to operate this machine. Healthcare in the country is changing big time. We are in a phase of transition. Regulations are changing, and then you know about things like Ayushman Bharat and stuff like that, which are changing big time. But I think on the clinical front, on the medical front, there are big changes happening, and which is the fourth piece. The first piece is a lot of emphasis needs to be laid and is being laid on preventive healthcare because the country doesn't have resources to manage all the illness that comes into the country, not just our country. Across the world, no country has the resources to manage the illness once it happens. Preventive healthcare has become a big thing. And Apollo Hospital, as a pioneer in preventive healthcare, it was probably the first hospital in the country which started the health checks, and now we've moved ahead and we're calling something called Pro Health, which is a preventive healthcare program, not a health check, it's a preventive healthcare program. More about that later when we talk. Then we've got more smarter. We've actually got into predictive medicine. Second P is predictive medicine. With a lot of data, artificial intelligence, and analytics, we're able to predict the disease occurrence or the chance of an individual contracting a particular disease and trying to prevent the disease and or tackle it at an earlier stage before it gets more complicated and worse. The fourth P is becoming personalized, especially in areas like cancer, we're getting into immunotherapy and all where the same drug is not used for all types of cancer for all the people. For the same type of cancer, different drugs are used based on the individual. It's more of a genetic and molecular based thing. It's becoming more and more personalized. And the last P is precision. People want to get quicker, get well quicker, faster, in a safer environment, and want to get back to work as soon as possible. And that's what precision medicine is talking about. And I think today's program is more about precision medicine. We will see more about it, but I think more than the mission, everybody's spoken about the technology, but more than the mission, I think it's the man behind the mission. We are all extremely proud, not just us at Apollo, but I think the country needs to be proud of what Dr. Satki and his team has done. He's dedicated his life not to cardiac surgery, but to minimally invasive cardiac surgery, and he's brought laurels to the country. He's done the largest series in the world, while the rest of the country and the rest of the world is grappling with cardiac surgery with large incisions, long recovery periods, long morbidity, staying away from work for a longer period of time. But Satki dedicated his life to minimizing the seriousness or the making it simpler and easier and making it quicker for the patient to get back to work. For that, I think you deserve a big round of applause. Now, moving to the next step, he did all his life. There are multiple people who, like Davison said, who put their fingers into minimally invasive surgery, cardiac surgery, but have never made it a passion or never made it a 100% minimally invasive program. He's probably the only person in the country who does 100% minimally invasive cardiac surgery. That's again a record which very few people across the world would stand up to. Now, he's not stopped there by using the laparoscopic technique for the minimally invasive surgery. He's moved a step ahead. Many people have already put their fingers into robotic surgery, but nobody has actually taken it up as a program, as an initiative which is on a continuous basis and is offered to all the patients. This will probably be the first program in the country where robotic surgery will be offered or will be an option for every and any patient who comes into the hospital. I don't want you to be misled when Dr. Satki said we did not do bypass surgery so far. I don't want you to be misled by that. He's already done open heart surgeries on the robot, with the robot, but it is valve replacement surgery. So it's already being done. So it's not something which is yet to be done. Valve replacement surgeries are already being done on the robot, and he's had a great success with it. And his team has done a wonderful job along with him. What he's speaking about is the next step of it, which is the bypass surgery, which is just a matter of time. I think we're launching it today. And I'm sure within the next couple of days, we'll take up the bypass surgery and make sure that the country sees the robotic bypass surgery very quickly. He spoke about all the technicalities of robotic surgery and the minimally invasive surgery. But all I want to say about it is in one sentence, where the man's or the human being's hand can't reach, the machine can reach. The machines can reach places in an easier way, in a quicker way, in a safer way, to places within our system where a human arm cannot reach. So they use it as an extension of the human arm, and it makes it more precise. And we can see it, if we can see it as a single X, I think Dr. Arpiti can correct me, with the robotic system, they can see it
6 times, yeah.
6 times larger. So when you see something 6 times larger, the precision with which you do surgery, the precision with which you do your work gets that much bigger. Now, the reason we are here today is any program which is brought into the country is because our chairman believes that India needs it and India deserves to get the best spot that is available in the world. And for the program to be successful, one of the most important things is people should be aware of it. People should be aware that it's being done in this country and people don't have to travel distant places. The largest series in the world has been done here. And people from all over the globe have actually traveled to Dr. Satki for minimally invasive surgery. And now it's time the world knows that we're doing robotic surgery, which is the next step, which I would call the father of minimally invasive surgery. So the world needs to know about it. And that's the reason we are having this program. And to make sure that you understand, it is very technical, but to make sure that you understand it, they've actually got a robot on stage, and they are going to help you to feel what it means to operate a robot and all the advantages that are there with it. And thank you for being here this afternoon, and look forward to you to take this message in a very aggressive manner to the people across the country so that they do get access to something which is available in their own country and which is not available in many parts of the world. And finally, I want to congratulate and wish you the very best. And I'm sure we'll very soon celebrate many milestones on what you achieved on the robotic surgery. Good luck to you and your team. Thank you.
So I thank Dr. Harkishan for the clarification. It's very important that everybody understands that you've already done robotic valve replacements, lung resections, tumor resections in the chest. So Obviously, our next step is going to be a robotic bypass. It will take a couple more days to perfect. When we talk about small 8mm boards and small instruments, this is what you need to see. I'm going to pass it around if you want to have a look at it. So, the hard operations are going to be done through holes that accommodate these stick-like instruments. So, and if you look at the tips of these instruments, they move in various directions. Again, demonstrated now. And like I said, some of you could actually come over and try them yourself. Yeah. Yeah, I think we should play Chairman's message. Yes. So if you can see it, if you want to see. If you can hand code it, pass it on.
I'm very happy that India today is doing robotic surgery in almost all fields of surgery. First it started with renal, then they went on to do other GI surgeries, gynec surgery. But most importantly, they have now jumped into the cardiac surgery. Very happy because this robotic surgery has three distinct advantages. Number one, it's a procedure where the surgeon has a better view of the organ that is. So the complications are minimal and the recovery is faster and the results are also much better. I'm happy that Satyaki is now the first in the country to have even started the robotic cardiac bypass surgery. He's a cardiac surgeon, has done over 10,000 cardiac surgeries. But the most wonderful thing about him is he has done the single largest minimal coronary bypass surgery in the country. At Bangalore, one day he told us, "Sir, can I discharge my patients in 24 hours?" I said, "How?" Because all that needs the nurse to go for an hour to the next day to the house to reassure you. So that shows that how safe the surgery is, how quickly the patient can be mobilized. And I compliment him for the great efforts that he has shown in Apollo Hospital in Bangalore. But I think all this came from his training in Harvard, which is my alumni too. So I feel proud that he came from Hyderabad alumni where he was, had his initial training in cardiac surgery. But today, he is a trained surgeon who has done the largest number of mixed surgery, namely invasive cardiac surgery. And now, remember, about 3 or 4 months ago, he went for a short while to look at the cardiac surgeries using robotic. And he has already done significant number of robotic cardiac surgery. And I think it's in him, spirit is in him. He's a highly talented surgeon, and having done this, you can say the difference between a CABG and minimally surgery is tremendous. But the patient doesn't feel anything, very least mobility, and early recovery. I remember there was a patient whom I sent from Chennai with 5 blocks. The surgeons felt that it was the highest for surgery. And the angioplasty or cardiologist felt maybe we may not be able to put the stent for all 5. So I sent him to Bangalore. 4th day he called me up and said, "Sir, this is a patient who wants to order him." And he did all the 5 minimal invasive grafts for the 5 vessels. I think I would call him as a very competent cardiac surgeon and compliment him for putting India on the global map. I always say that we are doing anything that's happening anywhere in the world. This is a core philosophy, saying we must be able to give our patients whatever is available by way of infrastructure, by way of technology, and the clinical experience. I congratulate Dr. Natyaki Purushottam Nambala. Wish many people will follow what he is doing. And he has no hesitation in training many people. I think this is where the next generation of cardiac surgeons will start into robotic primary invasive surgery or mix itself. The two they will learn for a better service to the patient at large. I wish him all the best. God bless.
So if you have any questions, I think we can take questions and then we can do the demonstration. Which I think may be better off because once you have your questions, I will also know what is it that you want to know, and then we can demonstrate the same thing with the robot. You want to see the video or you want me to explain? I actually gave the video, it did not play.
You can explain with the video and we should explain.
All right, fantastic. Can you bring up that video? Anybody wants to ask something else before it starts playing?
Forward, they should know about this, right? So how
Absolutely.
the hospitals will help out on that.
Absolutely. We have many visitors coming from many different hospitals, not only students, but also other surgeons who come and work with us for a couple of days, sometimes even a couple of months, learn and take it back.
So before going to the surgery, patients will scared while going to something like robotic assisted heart surgery. Heart surgery means people are
Already
obviously
scared, yes.
How come you will motivate them? Will you show some promo kind of about this? Demo kind of to the patients?
Not really, but we actually help patients meet other patients who already undergone the procedure and they have the confidence to go.
Compared to the conventional operation of the robot, the cost is going to come down.
I had somebody ask me this question earlier. What we need to understand is this: the cost is actually going to go up a little bit. It's going to go up approximately about 10 to 15%. But this increase in cost is going to be offset by various other benefits, which means that if you're going to reduce the amount of blood being used, or completely avoiding blood transfusion and associated infections, cost comes down. If you reduce hospital stay, cost comes down. If you send patients back home 2 days later, and the patient is able to return back to work a week later, economically it is beautiful, not only for the patient, also for the country. So I think cost is going to be reduced in several other, these are all alternative benefits that we don't see. We always look at what is the cost of that individual person. So I think cost-wise, the benefit is going to be significant because it's going to benefit in various other ways. Currently, it may not be covered under health insurance schemes. I think you are all people who are going to, who are going to really help in that kind of things. Because I think even the insurance companies are not aware of what is the important benefits of these kind of procedures. I did mention to some of you earlier that when you reduce, insurance companies need to understand that when you do through small incisions and eliminate infections, eliminate patients from coming back to hospital again and again and again because you've done a major cut and it is infected and it needs to be taken care of in a hospital setting, cost actually keeps on adding. They may tell you, okay, cost of open surgery is only this much. But all these additional costs that comes, having a patient stay at home for 3 months, requiring a nurse to take care of him at home, these are additional costs which we don't see. So, when you do these small kind of robotic or minimally invasive surgery, cost benefit is actually much higher. And I think you should take this message to insurance companies, writing, nicely about it. That's a very important question. It's probably not so good for pediatric heart surgery as of now. We don't have it those scales, but I think in the future it will be possible for all patients. But all other procedures can be done.
You already did the surgery or?
We've already done surgeries. Already done. So I'll show you the video of my own patients.
Many patients?
Currently, we've done about 25 patients.
Here in Bangalore only?
Yes, in Bangalore, Apollo, yes. And day after tomorrow, we have surgeries again. And probably we'll be doing one more meeting like this where we invite you to come to watch these surgeries if you're interested. Currently, only in Apollo Hospital in Bangalore. But if plan is to have it available in all the hospitals across the country, at least the major Apollos in every city. Robot is available, only heart surgery we are talking about. Robot is available in practically every Apollo hospital. Cardiac only.
Talks with the government regarding this? Have you given any presentation to the minister for the insurance?
For the insurance, no, not yet.
Has any plans of doing?
Definitely, the plans of doing that, but because I think they need to understand that for them, many of them feel that this is just cosmetic, but which is not. Can we have that video playing? It's not playing. You can connect my laptop. You take it and connect it. Yes. I think that is exactly the reason why we brought everything here. Because for many people, they think robotic heart surgery means the robot does the operation. That is not true. In robotic heart surgery, the surgeon uses the robot like a tool. I think Dr. Hariprasad mentioned that elegantly. It is an extension of the hand. So surgeon sits at the console and the robotic arms do the job. The surgeon moves the robotic hands just like he moves his hands. We'll demonstrate you shortly. Sir, you want to say something? I'll just connect this and come.
I think as we have already said, it is the pinnacle of the fusion between a certain skill set and the technology. So, as you rightly said, and then Dr. Hariprasad already explained, this is basically the robotic arms. You see that the rod kind of a thing. With such a small incision, you are able to reach without opening the chest. You are able to reach that part of the heart where you are operating. So the surgeon sitting at the console maneuvers and mobilizes, and as per the command of the surgeon, the way he moves his hand, and he does the operation. But the other end, of course, his hand may not be seen there, but the robotic arm does the cutting, mobilization, and the bypass for the surgery. And then getting this to the insurance companies, as you know, we had challenges in other fields also. When new innovation and technology comes, we have to take it to them, prove to them that, see, they are very sensitive about the price, the direct cost. So we have to present to them about the indirect benefit, long-term basis, how much money it saves, cost benefit analysis, as we explained. That if a patient gets back to work, after a conventional surgery, if it takes about 2 months or 3 months for him to get back, or maybe the earliest maybe 1 month. So by doing this surgery in less than a week's time, he'll be able to get back, or in a week's time, he'll be able to get back to work. So the overall saving to the nation, or overall cost benefit to everybody together, is certainly it's much more than the direct little extra cost which goes to the instrument. Conventionals, the speed, if you really look at, probably this may be a little faster. I don't know, Dr. Sadini. Can you answer this? The time taken for this surgery is how compared to the conventional surgery?
Whatever experience we have had so far, it takes approximately about an hour and a half longer. And this is still our initial experience, so maybe we may be a little more cautious and slow in doing things. But if you look at minimally invasive surgery, when we started, it used to take 5-6 hours to do. Currently, pure surgeries, minimally invasive surgeries are being done in 1.5 hours time. That means a patient who requires a triple bypass on a valve replacement, surgery is over in 1 hour 30 minutes, 90 minutes. Okay. And compare that to open surgery. A surgeon doing a triple bypass open will take 2.5 hours. So I think it's all about experience. As you do more and more, you become faster and faster and save time.
I think on a long-term basis, certainly time taken is going to come down, because In a conventional surgery, it is a just one open surgery. You have the preparation part much longer than the.
Will you play this? Thank you. So this is surgery being done in our own hospital. You can see that these are all, wherever I'm pointing are the ports through which those instruments that I passed on are going to go through. So usually about 4 such ports are required, sometimes 5. No, this is under general anesthesia. Patient is going to be completely unconscious. Patient does not have bleeding when you do these kinds of surgeries. So that's the robots being brought in, the same kind of console. And you can see how the robotic arms move. Surgeon actually sits at the console, a little away from the patient's table, and then moves those instruments using these kind of tools. These hand controls are as good as your hands. And as you move them, the instrument inside does the same job that the hand does. See that? And look at the resolution. Every little vessel on the above the heart is like basically the pericardium. That's a damaged heart valve. Like you do it with your hand, these 8mm stick-like instruments can do this operation. The valve replacement being done. That's artificial heart valve being seated there. Similarly, holes in the heart can be closed. Valve repairs can be done without replacement. This is a hole inside the heart. And that hole can be stitched up exactly like you would do with open surgery. You can look at the 4 sides, just small holes. I think we're done. Anything else that you would like to know?
Surgery done using the robotic.
So we've been at this for the last 7 to 8 months now. And surgeries are being done practically.
Remember the date of the first surgery?
Date of first surgery. You just check the date of the first surgery. 3rd August? Yeah.
And what was the patient, male, female?
The patient is a male patient who underwent a valve replacement. He's a young patient. He's about 32 years of age. She's better for them definitely because patients will come for other procedures and will benefit from this kind of thing. Patient is discharged on day 3.
How much of hospitalization would be needed? How many days?
Usually about 7 days.
And conventional?
Conventional is open surgery, isn't it? Open surgery takes about 7 days.
She's asking robotic bypass how many days?
Same, 3rd day, but it is possible to bring it down to 1.5 days. That means you do surgery today, patient leaves the ward next day, and probably by evening.
Conventional bypass?
Conventional bypass will take 7 to 10 days. With robotic, it can be brought down to 1.5 days.
Back to work in a week's time?
Yes. Yeah. Many of them are already jogging 4 kilometers at the end of the week after heart operation.
Usually the conventional or replacement, it takes a week.
Conventional valve replacement will take a week of hospitalization and at least 6 to 8 weeks to get comfortable. So driving a motorcycle, bending down, lifting something, will take 8 weeks. It's 2 months. Most patients may,
You used to give the options for the patients like.
like some of these patients may not want to undergo something that is new because they're afraid. That is the most common reason. Occasionally, some patients may refuse because they're not able to afford this kind of thing, even if it is 10 or 15%.
Valve replacement.
After valve replacement, complications usually don't happen. Here, in this kind of technology, if the surgery is smooth, most operative complications generally don't happen. Post treatment, no, it won't happen. The rest of the things are exactly like open surgery. It doesn't differ. It's just that the tools that you use are different.
Please remember, one of the reasons why patients in the conventional surgery stays longer, one of the reasons is because they have a major trauma on the chest. So post surgery, if everything goes fine, they have to go back to work or they can go back to their normal life. But this trauma needs to be healed on the chest. That's the reason why they have to stay in the hospital. Yes, in this case, there's no blood loss, there's no major trauma on the chest. Permissible amount of there is hardly any blood loss.
See, this is a closed chest operation, which means blood is not going to spill out. And in these kind of operations, whatever blood loss happens inside the chest is given back to the patient there itself because we're not exposed to the positive. That is why blood loss, even after surgery is like 100 ml, 150 ml. Patient goes into the operating room with a hemoglobin of 15. We leave the operating room with a hemoglobin of 15. Next time morning, we check hemoglobin, it's still 15. It's like that.
Procedure. What percentage of heart patients who may need this procedure?
What is the percentage? I think if you become if everybody becomes good at it, probably 80% will benefit from this. 80% of heart patients, adult heart patients, are suitable to undergo this procedure.
And as you told that you are going to start in Navi Mumbai in January. So this is January 2020, right?
Right.
So this will be the second such kind of center in
In the country, yes. In Apollo. In the country as well.
Okay.
Unless somebody in the next few days will also. Yes. Yeah. Yes. So for those of you, just a brief introduction. This is the console in which the surgeon sits. In the real setting, in the operating room setting, this console will be very close to the patient's table, operating table. And this is the robot. It has got 4 arms. That's okay. There's going to be a monitor or a patient card, as it is called, which the robot is connected to, and the whole system is then connected to the console there, the surgeon console. Everything is going to be seen there. Many things can be controlled from the patient card itself. The nurses who's assisting the operation can see there. All the assistant can see there. And in addition to that, there are going to be several monitors in the wall where everybody can see. You also have to note that this surgeon console has a monitor. Many of you can, if you're interested, you can come and see later on. You can see 3-dimensional, high-resolution image of this. So I think we will just sit and demonstrate to you how fine these instruments are. Ready? The surgeon exactly sits like I am sitting now, and he simply puts his finger. The beauty about this is this: if I lift my head, nothing moves. Once I put my face there and put my fingers through this, then the instruments start moving. Can you see that? I'm picking up that this is the grape here. that? See how this instrument moves? You can move the scissor in any direction that you want. It is impossible for the hand to do. See this? See that? Hand cannot do like this. Hand cannot do it in any direction that you want. See this? So, because it can move like this, it is possible for these instruments to go into small crevices and operate. And they are much. You can actually feel like grape. Just to show you how fine work can be done. This. Exactly like in open surgery, only if, in open surgery you need to use many instruments. Here with just a few instruments you can do the same thing with as much precision or greater precision than conventional. Just to demonstrate to you what is the range of movement. See how you could move this in any direction, and if you have to stitch this up, you could stitch like this, or you could stitch like this, any direction you want, which the hand cannot do. And you can use the right or the left hand, whatever you are comfortable, unlike when you use your own hands. Anything else you would like to see? You understood how this works? You can sit there and then control everything there. That's how robotic works. What do you want to do? We can actually show that as well, yes. Anybody has a 10 rupee note? How many has a 10 rupee note? You don't have to give it to me, just take a 10 rupee note and look at it. I'll take it out. So you can actually, I will drop this grape there. Yeah, you can keep the 10 rupee note there. I just want you to see. Can you see what I'm seeing? I'm sure with your bare eyes you cannot read it. It just next to the 10. As I zoom, you see, I could zoom even further, and this is the level of resolution. Can you imagine this? With the naked eyes, it's simply impossible to do this. Of course, when we do heart surgery, we do use magnification. Even with magnification, to get this level of clarity. That means you can see minute structures And for heart surgery, it's very, very important that we see these structures very clearly. Resolution is very important. It enhances the safety of what we do. Correct. Yes, we usually have 2 surgeons always in the operating room, and the team usually is of 5 people. 3 of them at least are trained in robotic work. There's a bedside surgeon who sits next to the patient. Controls of sports, changes instruments when required, helps in the surgery and setting up things. One surgeon sits there.
By the one surgeon.
Right.
Okay.
Sometimes we take turns. Half is done by one surgeon, another half is done by another surgeon. So rotation. You are the man.
So you would like to know how much is Apollo invested in this?
It's quite expensive. I think that's enough. It's expensive. We don't look at the money invested. I told you our chairman believes in bringing the world class technology because we deserve it. Pardon? We don't pass on this cost to the patient. It's an
The actual
investment.
cost of this device is approximately between 20 to 25 crores. So the cost usually comes down over time. As multiple people buy, multiple centers install, the cost comes down. Everything is manufactured in the United States. Currently, this is the only robot in circulation. A few other companies coming in the future. So,
At least being used in your PG.
yes.
We will present the entire team. I mean, maybe
Yeah. Everybody should come on
once it
stage.
is
Yeah.
over, we'll bring the entire
Exactly.
team.
How many have been trained, sir?
In our own center, 3 people are trained. It will be interesting for you to know that we are the only people trained in this country, certified to operate robotic cardiac surgery.
For you to come to know about this surgery, but training for you, I'm asking. The robot.
This is the latest device available. Old device we have used in 2000, I have used in 2006. So, and since then we've been doing minimally invasive surgery. I think for somebody to be able to use this very effectively and safely, a minimally invasive experience is very important. And that is what we have. And I think that is why this is going to be a successful program compared to many others who have failed. It's now 11 years of minimally invasive surgery. A lot of experience.
Narayana was one of the pioneers of using Da Vinci technology for their other surgeries.
That's why I think you should. I recall what Dr. Satyaki has said. See, robotic system was very easily adapted into other fields of surgery because it's a much bigger base where you're operating. But when you're operating on heart, you're operating on such a tiny vessels and a tiny area. So that we were able to adapt it more successfully because, as Dr. Satyaki said, we have mastered the art of MICS first. Then it became easier for us to adapt this.
Did that satisfy you?
It is in the heart. So
Narayana has never done a single robotic surgery of the heart.
I know that you were the first. So I just why was
Why Narayana is not able to do it?
not why you
Yeah.
were not able to do it.
Yeah.
Why you were opted before that? Why that?
Not opted, they also got the robotic system. They have the robotic system, but they have not used it for cardiac surgery.
No, it works like this. Everybody can buy equipment, but to be able to use that equipment, you need specific training. And specific training is dependent on people. Some people may be very interested in doing that training. Some people are not. And even yes, not always from one country. Many of us train in many countries with many groups. Basically, we have to go and work with another surgeon to learn this. And once we learn, other surgeons come to us to learn from us. We get people from Europe to come and learn from us. We get people from Canada, from the US also to come and learn from us. So and of course India. This training program happens 6 to 8 times in a year. They come, they watch 5-6 surgeries in a couple of days because they see how we work, how the team works. And like that, we also go and learn these new things from other people. Yeah, exactly. Some surgeries may be very good at, some surgeons may be very good at valve replacement, some surgeons are very good at bypass surgery. For medical centers as well. You want to, exactly, I think we should give them a hands-on. Whoever wants to come, please come. Don't be hesitant, don't be scared, please come. We don't have much time, probably 4 or 5 people should come forward. You will never get a chance like this again. Use your thumb, middle finger, and your index finger. Okay? These to go in this. And then there. Yeah. You can put your middle finger and your thumb. You don't have to use your feet into this. Is this too high for you? This can be controlled. I can bring it down if you want. Can you see the resolution inside? How 3D is? That is 3-dimensional. Yes. That's my 10 rupee. If you destroy it, you have to give it back to me. You're using scissors to cut it. That's okay. So now you understand, right? Yeah. That's not the scissors. The scissor is in your right hand. With your right hand. With your right hand. This hand, yeah. See that? You're moving the scissors now. See that? Yeah. Prashant, not only that, you can do your wrist movement and see. So what has happened currently is that you have zoomed in a lot. You want to zoom out. And you can see it better. Thank you very much. I'll come back. They can do it. They're just experimenting. Yeah. Sure, sir. Thank you. What is that Indian economy? She's destroying the Indian economy. Already. Patient table is here, the console is here. Here there are nurses and other surgeons sitting very close to the patient. Yes, the same thing, yeah. The robot actually comes over the patient like that, and you control with this. Absolutely. See this. As I do that, you should see how this moves because see the control. Yeah. See how it moves. The instruments are really, really small. And, yeah. Yeah. That's great. See the control. No, this is has to be disposed of after about 10 uses. Yes, 8 uses. Standard like instrument system is both the sterilization room, heat sterilization. The last patient was 110 kilo female patient. Extremely difficult.
నాకు ఇదే కదా లాప్రోబయోమిక్
She's 31 years old.
బయట తీసుకున్నాను ఇంట్రెస్టింగ్
Nice video.
తీసుకొచ్చి
Whichever direction you want, yeah. Right, now, single. Currently, we've done deposits. We've not done only 4 years. Most of them are that. Most of them are that. Say bad replacement, also the heart, one of chest tumors, gas tumors, MFPs. I think you're looking at probably 8 people. It's easy to light it. Tomorrow I will start this one. Yeah. Many times, patient privacy is important. A regular heart surgeon.
So,
One is of course specific training. Second thing is many heart surgeons are not comfortable unless they have everything seen in front of the life. It's about brain. All the cell treatment. Everything manufactured. Yes. Yeah. Another cash. Yeah, please.
I request the entire team to come on the stage.
Will I go for a bite there? I want to. Yeah, that's okay. ಸರಿ ಗೊಬ್ಬರಲ್ಲ ಕನ್ನಡ ಬರುತ್ತೆ ಕನ್ನಡದಲ್ಲಿ ಟೆಕ್ನಿಕಲಿ ಮಾತಾಡೋದು ಬಹಳ ಕಷ್ಟ ಮಧ್ಯ ಮಧ್ಯ ಒಂದು ಇಂಗ್ಲಿಷ್ ವರ್ಡ್ ಸೇರಿಸ್ಕೊಂಡು